क्या आप या आपके परिवार में कोई डायबिटिक है? जानिए भारत के प्रसिद्ध डायबिटीज स्पेशलिस्ट से कि डायबिटीज को कैसे करें मैनेज। सीधे अहमदाबाद से, जहां देश विदेश के 5000 डायबिटीज एक्सपर्ट्स एकत्रित हुए हैं। डायबिटियोलॉजिस्ट डॉक्टर्स की एनुअल कॉन्फ्रेंस RSSDI में 22 से 25 नवंबर 2018 तक। लॉग इन करें फेसबुक पेज डायबिटीज पर चर्चा पे।
Welcome Dr. Ajay on Diabetes Per Charcha. So doctor, what makes Indian population more prone to diabetes?
See, as you must have also experienced and seen in your families, the incidence of diabetes is increasing day by day. Every family almost has one or the other diabetic patient. The reason behind this is the change in diabetes, change in our lifestyles that has occurred over the past 25 to 30 years. And genetically, as a race, we Indians are more prone because we have more fat content in our body. There is a type called as thin fat Indians. Also, although we might be thin, we have more fat in our body. This excess of fat around organs and in our body makes us prone for diabetes. And on top of that, there has been a change in the environment that we are living in, the things that we are eating, the lack of the change in the lifestyle. Even in rural areas, you will see that the amount of physical activity that our fathers or grandfathers used to do has decreased as compared to our present generation or our next generation. A combination of all these factors, genetic predisposition, change in our food patterns, plus a change in the lifestyle in the form of a more sedentary lifestyle has contributed to this present pandemic of diabetes, I would say.
So over time, what kind of complications can occur in diabetes patient?
The thing that we have to stress to our patients is that diabetes is a lifestyle disorder. We have to think about controlling diabetes to prevent complications, because it's not just the high sugar that is the problem. It is this high blood sugar which affects the eyes, the kidneys, the nerves, the heart, the brain, which causes all the problems. So the complications that are seen are basically kidney failure, diabetic retinopathy leading to blindness, increased incidence of heart attacks, increased incidence of paralytic attacks, amputations, that is the cutting of legs due to gangrene developing in the legs. All these are complications and diabetes, and the good thing is they are potentially preventable. This is what all the people should be knowing about, that we can prevent these complications. They don't occur in one night. When over the years diabetes remains uncontrolled, when the blood sugar remains uncontrolled, it affects the various organs of the body, and the complications that I just listed, they occur. So we are treating diabetes to prevent complications. The point that I would stress here is that patients shouldn't think that they are having some disease or problem if they are having diabetes. The aim of diabetes treatment is to prevent all these complications.
So we have seen that diabetes patients are more prone to heart problems.
Yes.
So are there any early identifiers of cardiovascular complications?
Absolutely. Most diabetic patients die of heart attacks. A person with diabetes has a 4-fold increased chance of getting a heart attack, and many a times it remains undetected. A patient knows that he has heart problem only when he lands up in a hospital with a acute myocardial infarction or a heart attack, that we say in a common man's language. This is also potentially preventable, provided if you give cognizance to the symptoms at an early stage, like shortness of breath. If you feel a diabetic patient doesn't know that he has heart problem because he doesn't get a chest pain that a normal person would with a heart problem would get. So the earlier symptoms are like, say, shortness of breath, increased fatigue, atypical chest pain like pain in the jaws, pain in the backs. This should alert a person that he might be suffering from some heart problem, and he should give importance to these problems. When he develops these symptoms, he should immediately consult his or her doctor.
So how regularly a newly diagnosed diabetes patient should follow up to avoid development of complications?
That's the most important part of diabetes management. Not just the blood sugar, but there are a certain few tests which should be done on a regular interval, like checking for your lipid profile, checking your kidney function test, liver function test. These should be done at least annually. Blood sugar should be checked at least once in 2 or 3 months, if not monthly. HbA1c, which provides average blood sugar over the past 3 months, should be done on a 3 months basis. This is what should be done ideally. An eye examination in a normal patient without any retinopathy should be done once in a year. Screening for urinary microalbumin should be done at least once in a year. These are some of the tests which a diabetic patient should be doing on as a part of his daily life to prevent the complications that we discussed about just now.
Thank you, Dr. Ajay, for giving us information on diabetes and its complications. And thank you for being with us on our talk show, Diabetes Par Charcha.
Thank you.